Hey everybody, I'm re-recording BLS part 1 and I'm hoping that that works for you guys. I'm sorry I didn't know that on my end it didn't sound like the voice was real low or that it was difficult to hear, but evidently y'all were having a hard time hearing it, so I'll give you a little longer to make sure that you get to hear that entire video. So I'm going to get that started again today. If you have questions or problems, please let me know. The only way I can fix a video or redo one is if you let me know. So you guys let me know what's going on and I'll be glad to fix it. So let me get this started and you'll be able to watch that. And I'm going to turn me off so you don't have to watch it while you're watching the video. Well, maybe not. Maybe it does keep recording. Sorry, guys.
American Heart Association. Those are just a few stories of providers who know the importance of what you're about to learn. Basic life support, or BLS.
On any given day and at any time, you could encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. And with the training you receive today, your actions can give the victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. Cardiac arrest occurs in both men and women, but for demonstration purposes in this course, we will perform CPR on adult male victims.
It's been Mary just checking in today.
No, that's not going to work.
John, what's wrong? Are you okay? John? John! Help! Someone please help!
Got a person down transoceanic counter 24.
Wake up, John, wake up.
Sir, are you okay? Can you hear me?
He was just on his phone and then he fell over. I don't know what happened.
Possible cardiac arrest, medical assistance needed.
What?
1, 2, 3, 4, 5, 6, 7, 8.
I'll get the AED.
10, 11, 12, 13, 14, 15, 16.
Ma'am, I'm gonna need you. Is he gonna be okay? Excuse me?
1, 2, 3, 4, 5, 6, 7, 8.
There's your pocket mask.
Apply pads to victim's bare chest.
I'll attach the AED around your compressions.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12,
Plug in
14,
pads.
15, 16, 17, 18, 19,
Analyzing rhythm. Do not touch victim.
Stop compressions. Clear the victim.
Shock advised. Charging. Do not touch victim.
Keep clear.
Press the shock button now. Shock delivered.
Are you okay to
Resume
continue?
chest compression.
Let me know when you need me to take over compressions.
6, 7, 8, 9, 3.
Excuse me. I'll take over compressions. Check the pulse. He's got no pulse. He's not breathing. Start CPR. How long was he down?
About 2 minutes. I started CPR right away. She attached
Attach
an
the
AED
pads to our
around
defibrillator.
13, 14,
Did you deliver a shock?
We did deliver one and then more compressions and 2 breaths.
2.
Analyzing rhythm. Do not touch victim.
All right, back up.
Clear the victim for analysis.
No shock advised. Resume chest compression.
Wait, he just moved. We've got an organized rhythm.
I have a pulse. He's breathing.
Let's move him.
Let's get the stretcher. You come with us. We're going to go to the hospital.
Okay, thank you.
First, let's talk about the adult chain of survival. There are 5 links in the chain. It starts with immediate recognition of cardiac arrest and activation of the emergency response system. Then it moves to early cardiopulmonary resuscitation, or CPR, with an emphasis on chest compressions. After that, rapid defibrillation is used. The next link in the chain is effective advanced life support that leads finally to integrated post-cardiac arrest care.
There are slight differences in these links if you're inside the hospital. The first link is surveillance and prevention of cardiac arrest with patient monitoring and assessment by the medical emergency team or rapid response team when a patient's condition is starting to deteriorate. The next link is early activation of the code team, followed by early CPR, early defibrillation, and post-cardiac arrest care. Post-cardiac arrest care may be provided in the cath lab and ICU. And this chain is really a useful metaphor to understand the connection and flow between the stages of emergency cardiovascular care. We just witnessed the chain of survival in action with the victim seamlessly treated. So now, let's go back and review the links in the chain of survival as they happen.
It's a normal day at the airport. We see the man's wife notice that he's not looking well. After he collapses, she immediately calls for help. A security guard rushes over to help. The guard gets no response or sign of breathing, so he directs a coworker to activate the emergency response system. The chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system.
A rescuer must recognize that the victim is in cardiac arrest based on unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or triple a victim's chance of survival. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult suddenly collapse, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers may provide further instructions and guide the bystander until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The guard immediately begins chest compressions without delay.
The second guard returns with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal. Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the victim loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing layperson and healthcare providers to attempt defibrillation safely. As the EMS providers arrive and take over care, they extend the chain to give the victim the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the victim. Once the return of spontaneous circulation, or ROSC, is achieved, the victim is transported to receive post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and on interventions that can improve long-term survival. These 5 links of the chain, immediate recognition of cardiac arrest and activation of the emergency response system, early CPR, rapid defibrillation, effective advanced life support, and integrated post-cardiac arrest care, show the most important actions needed to treat cardiac arrest. Basic life support is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for victims of all ages and practice delivery of these skills both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review the rescue again, pointing out the steps of basic life support as they happen.
You can see the guard scan the scene to assess safety in the terminal, even alerting another officer on his radio. First, he tries to get the victim to respond. Then, he checks the man for breathing by watching for chest rise and fall. He sees no sign of breathing.
Although the guard detects no breathing here, abnormal breaths are common in the first minutes of cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR.
As a lay rescuer, the guard does not check a pulse. Lay rescuers should not check a pulse and should assume that cardiac arrest is present if an adult suddenly collapses or an unresponsive victim is not breathing normally.
We see the guard start CPR by removing the victim's shirt and giving chest compressions. You can see that he places the heel of one hand on the center of the chest, just over the lower half of the breastbone. Then, he places the heel of his other hand on top of the first, and he keeps his shoulders right over his hands for leverage, with his elbows straight.
The critical characteristics of adult high-quality CPR are to push hard and fast at a compression rate of 100 to 120 per minute and a depth of at least 2 inches or 5 centimeters. Allow complete chest recoil after each compression and minimize interruptions in compressions to less than 10 seconds. There is some evidence that compressions that are too deep, more than 2.4 inches or 6 centimeters, can increase injuries from CPR. However, most providers do not perform compressions deep enough. You should focus on making sure your compressions are at least 2 inches or 5 centimeters deep. We recommend the use of feedback devices to ensure that your compressions are the correct depth. We'll talk about feedback devices later.
And as you can see, giving compressions requires intense effort. You'll discover this in a few minutes when we practice chest compressions. After the second guard returns with the AED and kit, she first turns on the AED. She then removes the adhesive backing and attaches the pads according to the diagram.
And the compressions are given throughout the process to keep blood flowing to the victim's heart and brain. Once the AED is powered on, it will give audible prompts on what actions to take.
Right here, the AED prompts responders to stop compressions while it analyzes the victim's heart rhythm. It takes just a moment for the AED to advise that a shock is needed. The second guard makes sure nobody is touching the victim so that the electrical current from the AED doesn't transfer to someone else. And then she delivers the shock.
Once the shock is delivered, most AEDs will give a prompt to resume compressions. But if it doesn't, compressions should resume immediately.
The guard initially provided compressions without ventilations because he did not have immediate access to a barrier device such as a pocket mask. Once the AED that included a pocket mask arrived, the guard was able to provide compressions and ventilations while the second rescuer used the AED.
The EMS team has arrived to take over. They use good team dynamics by asking the guard to summarize the history of events and care provided.
The EMS team assesses the victim and confirms that he is still in cardiac arrest, so they resume CPR. Now, ventilations are provided using a bag mask device.
The EMS team attaches their manual defibrillator to the victim. The device used by this team can be set to manual or AED mode. Use of the defibrillator in the manual mode requires advanced training to operate that we won't be covering in this course. In this scenario, the defibrillator is set to AED mode.
The AED advises that no shock is required, and the victim begins to move and breathe. The EMS team identifies an organized rhythm and a pulse.
It's worth mentioning that there are many ways that this scenario could have been different. This scenario shows how an integrated system of care helped to achieve a positive outcome, from the bystander recognizing a problem and getting help, to the lay responder initiating care, to the EMS team arriving, stabilizing, and transporting the victim to the hospital for post-cardiac arrest care.
You never know what situation you'll face or what resources will be accessible. But our goal is that with today's training, you'll have the knowledge and a framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
To begin training, we'll focus on individual skills that rescuers perform. It's most effective to perform CPR as a team. However, to be an effective team member, you'll need to possess the individual skills of CPR. So we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then tap and shout to determine responsiveness. If there is no response, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the victim's chest, looking for chest rise. Check a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you, the rescuer. Locate the victim's trachea by using 2 or 3 fingers and then slide your fingers into the groove just to one side of the trachea where you can feel the carotid pulse. You can scan for breathing and check a pulse simultaneously to minimize time before first compression. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not definitely feel a pulse, ensure that help is on the way and start chest compressions immediately. In this practice session, you will first check for scene safety. When the scene is safe, approach the victim and tap and shout to determine responsiveness. If the victim does not respond, yell for nearby help and check for breathing and a pulse. If there is no breathing or only gasping and no pulse, ensure that help and an AED are on the way and immediately begin CPR, starting with chest compressions.
We'll pause here before we practice checking for scene safety, responsiveness, breathing, and pulse. So position yourself to the side of your mannequin to practice. The instructor can begin when everyone's ready. So let's begin. We'll start in 3, 2.
Okay.
Now we'll see a scenario with rescuers from multiple agencies.
The real challenge in situations like this becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved.
Dispatch, this is Engine 1. We're on the scene.
Copy that, Engine 1. Time is 14:55.
Dispatch, we have one vehicle upright, no signs of damage, no hazards noted. We have 2 victims present, one is still in the vehicle.
Engine 1, one vehicle upright, no hazards noted. 2 victims total, 1 still in vehicle.
What's his name? Russ. Hey, Russ, can you hear me? No response?
So what happened?
We were driving and my dad started having chest pains and we rolled into a ditch and he just now passed out. No breathing. No pulse.
This is cardiac, not trauma. He needs CPR right away. Alert the medics that we have a cardiac arrest and get the AED. Got it? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Attach pads to patient's bare chest.
5, 6, 7, 8, 9, 10, 11, 12,
Plug in pad
13,
connector.
14, 15, 16, Jacob, get ready to rotate in for compression. 21, 22, 23, 24, 25,
Analyzing
26,
heart
27,
rhythm.
28,
Do not touch
29,
the
30.
patient.
Clear, clear, clear.
Shock needed. Charging.
1, 2, 3, 4, 5,
Stay
6,
clear of
7,
patient.
8.
Deliver shock now.
All right, clear, everybody. Clear.
Shock delivered.
1, 2,
Resume
3,
CPR.
4, 5,
Start with
6,
compressions.
7, 8, 9, 10, 11, 12. What do we got? 13, 14. Victim in cardiac arrest when we arrived. No sign of trauma. The daughter says he was having chest pains and went unconscious just before we arrived. We shocked him once and we've been at for about 3.5 minutes. Thanks. We'll switch out monitors after the next rhythm check. Jacob, compress a little more deeply and avoid leaning. 22, 23, 24, 25. That's better. 26, 27, 28, 29, 30. One, two, three, four.
Analyzing
five, six,
heart rhythm.
seven,
Do
eight,
not touch
9,
the patient.
10. Clear the patient. Clear.
Shock needed. Charging.
1, 2,
Stay
3,
clear of
4,
patient.
5,
Deliver
6,
shock
7,
now.
8. Clear patient. Clear.
Press the flashing button now.
Shock.
Shock delivered.
1, 2, 3, 4,
Resume
5,
CPR.
6,
Start
7,
with compressions.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3.
Good job with chest compressions. Keep it up.
6, 7, 8.
We should start an IV. Let's
Hey,
draw.
I just saw some eye flutter.
Stop compressions. Check the monitor. We have an organized rhythm.
Let's check the pulse.
We've got a pulse. Hey, Russ, can you hear me? Come on, Russ, wake up, Russ. No response.
Is he breathing?
No, I'll continue bagging.
Remember to give one breath every 5 to 6 seconds. I'll start an IV. Let's get a blood pressure. How easy is he to bag?
His ventilation's good.
Let's get ready to transport.
Let's watch this scene again, paying special attention to the use of the AED and providing breaths by using a bag mask device. When the team members arrive, they assess the scene and try to get a response from the victim. The emergency responder takes a few seconds to check for breathing, looking for no breathing or only gasping, and at the same time, attempts to feel for a pulse. Finding no breathing and no pulse, the team alerts the paramedics en route that this is cardiac arrest. The team moves the patient to a hard, flat surface to begin CPR. One rescuer starts compressions while the second delivers ventilations. A third rescuer sets up the AED and begins attaching the pads to the patient.
During compressions, the compressor counts to 30 so that 2 breaths can be given after each set of 30. The AED is attached and signals that it's ready to analyze. This provides an opportunity for the compressor to switch. We need to point out that it's important to know your AED or defibrillator because there are different models, and it's also important to follow your device's prompts. You may have noticed that the compressor took advantage of the time the device was charging to deliver a few crucial compressions.
High-quality CPR and rapid defibrillation are priorities. The emergency responder operating the AED is responsible for clearing all rescuers to allow for rhythm analysis. If a shock is advised, the emergency responder again clears everyone and delivers the shock.
As soon as a shock is delivered, another set of compressions begins with a different rescuer delivering compressions and using a feedback device. Feedback devices can monitor CPR quality regarding rate, depth, and chest recoil, and provide real-time corrective feedback to rescuers. After each set of 30 compressions, the emergency responder delivers 2 breaths, ensuring that the chest rises with each breath.
The paramedic team has arrived. Now, the team leader directs the handoff without any interruption in CPR by providing a summary of events.
Now let's focus on the use of the AED. You'll need to take a moment to familiarize yourself with the type of AED device used in your training class today. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED. Just open the carrying case or the top of the unit and simply power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's chest by using the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the victim's age, use the adult pads. You may also need to plug in the pads for certain models.
Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple and the other on the victim's upper right chest, directly below the collarbone.
After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the victim's rhythm, followed by a prompt to clear the victim. The rescuer should strongly repeat the command to clear, checking visually to be sure that all rescuers and people receive the command. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. The rescuer should again repeat the command to those nearby. Loudly state something like, "Everybody clear," or simply, "Clear." And visually make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then the shock can be delivered. Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the voice prompts of the AED. If at any time the AED indicates no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if a victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of adult pads, you can apply 1 set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of the pads to the bare skin.
Water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart.
If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump, smaller than a deck of cards. If you see this lump, avoid putting the pad directly over it.
Also, do not place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that model. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on the victim.
Will you hand me a paper towel, please?
Sometimes a cardiac arrest can occur where treatment is delayed, either because of barriers to accessing the patient or the arrest not being witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater his or her chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
So let's take a look at an instance where CPR was delayed.
Ready for lunch?
I'm not feeling well at all.
What's the matter?
I'm feeling like my stomach is upset. Just really lousy. And they've been coming down with something.
Let me get you some water.
Yeah, I could really use. Oh, I need to head to the bathroom.
You gonna be okay?
Yeah, I think I overdid it with the gardening this morning. I'll be fine after I wash up.
Sam, you all right? Sam, you've been in there for a long time. Sam, are you okay? I'll call 911.
Medic 2 respond, medical emergency, 1105 Country Road 59, unconscious male.
Medic 2 responding.
Medic 2, no other units available for backup. We will dispatch another unit when available.
Thank goodness he's inside. The dispatcher asked me to do CPR, but I couldn't do it.
What happened, ma'am?
He wasn't feeling well. He said it was just his stomach. So he was in the bathroom for a while.
Okay, what's his name?
Sam.
When did he say he didn't feel well?
Maybe before lunch, and he went in to wash up in the bathroom.
How long has it been since you found him there?
I don't know, 10 minutes, and I was worried about him. I checked on him, and he wouldn't respond to me, so I dialed 911. Company's in here, to the left.
Hey, Sam, are you okay? No response. He's not breathing. I can't get a pulse. Let's move him to the other room. Let's start CPR.
Attach pads to patient's bare chest.
4, 5, 6, 7, 8, 9, 10, 11,
Plug in pads connector.
14, 15, 16, 17.
Analyzing heart rhythm. Do not touch the patient.
Clear the patient. Clear.
Clear.
No shock advised.
Resume compressions.
1, 2, 3, 4.
We'll switch compressors at the next rhythm check.
11, 12.
Analyzing heart rhythm. Do not touch the patient.
Clear the patient.
I'm clear.
No shock advised.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3. All right, let's recap. We have an unwitnessed cardiac arrest. We've been at CPR for 10 minutes. We've had no shockable heart rhythm at any time. Is there anything else we haven't done? All right, I'll go ahead and contact medical control to let them know the patient's status and await further instructions. Until then, let's continue high quality CPR.
So you could see there that the series of events guided the two rescuer team providing high quality CPR. And then their two rescuer actions provided crucial minutes of quality care until advanced life support arrives.
Actually, for many healthcare providers and other rescuers, the two-person or team rescue is a more common occurrence. So let's first look at the roles for two-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. So they basically treat the situation at first as a one rescuer scenario. And the second rescuer is responsible for powering up the AED and attaching the pads.
Now let's review some of the points for two-rescuer BLS.
Rescuers should pause compressions when giving breaths until an advanced airway is in place. And if you're performing CPR without an AED, rescuers should switch roles when fatigued or after every 5 cycles. That's about 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze. This switch should take less than 5 seconds to minimize interruptions in chest compressions.
The rescuer giving breaths should monitor compression rate and depth, watch for complete chest recoil, and give feedback to the compressing rescuer regarding proper technique.
So now you'll be practicing and working as part of a two-rescuer team. For most healthcare providers and other rescuers, a two-person or team rescue is far more common. In two-rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out.
Rescuer number 1 should be positioned at the victim's side, ready to perform chest compressions and count them out loud.
And rescuer number 2 should be positioned at the victim's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for chest rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
So let's practice 2 rescuer BLS. Follow the video footage and prompts as you practice. We'll work on the full sequence from the point of finding the patient until advanced medical help. It's a wonderful thing to see teamwork move so smoothly.
That collaboration is partly due to the staff knowing BLS and their responsibilities and to them communicating well. It's also due to a team leader giving directions clearly. Successful team dynamics are critical during a resuscitation attempt. The interaction among team members has a profound impact on the effectiveness of each individual's performance as well as the patient's survival. The better you work as a team, the better the potential outcome for your patient. That's why it's so important to understand not just what to do in a resuscitation attempt, but how to communicate and perform as an effective team, regardless of your role as team member or team leader. To appreciate good team dynamics, it helps to understand what happens when team dynamics fail. Let's watch the following example of poor team dynamics and see if you can spot the areas that need improvement.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
We've got a teenage boy in full arrest here.
8, 9. Watch out, watch out. All right. Move him over. All right. Stop. He's still strapped to the cot. All right. Move on 3. Ready? 1, 2, 3.
When we got there, he just said he wasn't feeling very good.
Let's go ahead and hook him up to the monitor. We need to ventilate.
We've already shocked him twice, once about a minute ago.
We need to get an IV started.
Have you shocked him? 6.
Yeah, last time a minute ago.
James, take over compressions.
Okay, I'm fine. I'm fine.
Got it.
James, you need to do continual compressions with a breath every 10 seconds.
No, do 30 and 2. What have you done besides shock?
Just basic life support.
Laura, can you take care of that IV? Okay. Who's documenting? Kayla.
I'll get on it.
The scenario you just watched presented some serious communication flaws, the kind of flaws that can derail a resuscitation attempt. Successful teams not only have medical expertise and mastery of resuscitation skills, they also practice good communication skills and adhere to the key elements of effective team dynamics. These elements help teams work together in the most efficient way possible. The American Heart Association has grouped the elements of team dynamics into 3 categories: roles, what to communicate, and how to communicate. Let's review those now, starting with roles. Clear roles and responsibilities should be immediately established. When all team members know their jobs and responsibilities during a resuscitation attempt, the team functions smoothly. The designated team leader should clearly define and delegate tasks according to each team member's area of competence. Every member on the team should know his or her limitations, and the team leader should be aware of them. Team members should ask for assistance and advice early, not when the situation deteriorates. Sometimes a team member or team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you have to correct a colleague before he or she makes a mistake, whether it's a drug, dose, or intervention. The next category is what to communicate. Knowledge sharing is a critical component of effective team performance. Team leaders should ask for good ideas for management and frequently ask for observations from team members about possible oversights. Summarizing information out loud is a good way to maintain an ongoing record of treatment and acts as a way to reevaluate the patient's status, the interventions performed, and the team's progress within the algorithm of care. This technique can also help team members respond to the patient's changing condition. The last category of team dynamics is how to communicate. Closed-loop communication is important for both the team leader and team members. When the team leader gives an order, the team member should confirm that he or she heard and understood the order. The team leader should call people by their names and, if possible, Make eye contact to ensure that the team member has understood the order before assigning additional tasks. The team member should tell the team leader when he or she has completed the intervention. Team leaders and members should also use clear messages. Using concise, clear language helps prevent misunderstandings. Speaking in a tone of voice that is loud enough to understand, but also calm and confident, helps keep all team members focused on the task at hand. All team members should display mutual respect and a professional attitude to other team members, regardless of their personal expertise or training. Because emotions can run high during a resuscitation attempt, it's especially important that the team leader speaks in a friendly, controlled voice and avoids shouting or aggression. Not only is it important to know what to do during a cardiac arrest, but it's just as important to know how to work together as a team during an event. Debriefing as a team is an important component of every resuscitation attempt. Such debriefing during and after an attempt helps individual team members perform better, and it may also bring system strengths and deficiencies to light. Implementation of debriefing programs may even improve patient survival after cardiac arrest. Now we'll see the same scenario with everyone using good team dynamics. See if you can spot each key element in use.
Hi, everyone. EMS just called in and said they have a 16-year-old male who arrested in their unit as they were arriving. They're unloading now, and Pam is meeting them in the ambulance bay. She'll ventilate when they arrive. James and Aaron, can you two cycle through chest compressions for the first rounds? James, you're first on compressions, and Aaron, I need you to hook them up to our monitors and defib.
Yeah, I'll start on compressions.
And I'll have monitor and defib.
Okay, good, thanks. Laura, can you take IV and meds?
Yes, I'll take IV and meds.
Kayla, I need you to record.
I'll record.
Great.
Hi, we're a BLS crew with a 16-year-old male here who witnessed cardiac arrest precisely 3 minutes ago. We started compressions, applied our AED, and gave one shock with no rust. We then gave a second shock at the 2-minute mark with no change that we could see. He has been easy to bag.
Okay, thank you. Let's move him over at 30. 28, 29, 30. 1, 2, 3.
Okay, Mike, I'll take over compressions.
All right, thank you. Good switch. James and Aaron, you can swap out compressions every 2 minutes or sooner if you get tired. Okay. Do we have an IV?
No, I'm working on the IV now.
Laura, if you can't get the next to stick, try an IO.
I'm recording.
Okay, monitor is attached.
Hold compressions. Do not feel a pulse. He's in PEA. Continue CPR.
Okay, IV is in and flushed.
Good.
James, you should provide continuous compressions and I'll give a breath every 8 seconds.
Are you sure? I think it's 30 to 2 until an advanced airway is in.
He's right. Good catch, James. Continue 30 compressions with 2 breaths for now. Kayla, can you provide a summary of the action so far?
We've inserted an IV and attached a monitor.
As you've just seen, designating team roles and good communication allows for a rapid and orderly response in an emergency situation. Clear direction and effective communication by all team members creates an environment where patients have the best chance of survival. The ideal situation is a team with multiple rescuers to perform all needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, members may be assigned more than one role. Some roles have a higher priority than others. The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes, or sooner if tired. The rescuer, positioned by the victim's head, maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive ventilation. The team member operating the AED or the monitor or defibrillator typically alternates roles with the initial compressor. Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. That's because it's important for the team leader to monitor CPR quality, including the depth of chest compressions, chest recoil, and chest rise from ventilation. Often, the team leader will be at the foot of the victim. However, The team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed. The timer or recorder keeps a record of the events that occur, including frequency and duration of interruptions in chest compressions, time of shock delivery, and medication administration. When additional advanced responders are available, one rescuer is responsible for starting an IV and administering medications. This rescuer should be positioned at the victim's side, near the hands and legs, to avoid interfering with compressions and ventilation. When only 2 rescuers are present, they typically take the roles of compressor and airway, with one rescuer also covering monitor or defibrillator and team leader. If 3 rescuers are present, they take positions around the victim in the 3 critical roles: compressor, airway, and monitor or defibrillator. Now, let's apply the information you learned in the Team Dynamics video.
Your team will be asked to treat a cardiac arrest victim.
Your instructor will read a scenario and choose a team leader.
This scenario will run for 10 minutes with the goal of providing high-quality CPR and enforcing the principles of highly effective teams. This exercise is purely practice and not a test. The exercise will, however, reinforce both skill performance and improving the overall resuscitation provided to the patient.
To evaluate the resuscitation provided, your instructor will be looking for high-quality CPR, which includes compressing at least 2 inches or 5 centimeters on an adult victim at a rate of 100 to 120 compressions per minute, allowing full chest recoil between compressions and avoiding excessive ventilation. Another critical component of high-quality CPR is minimizing pauses in compressions, so your instructor will be measuring chest compression fraction, or CCF. CCF is the proportion of time during a resuscitation attempt when the patient is receiving chest compressions. Fewer interruptions are associated with increased ROSC and increased likelihood of survival to hospital discharge.
Targeting a high chest compression fraction is desirable for survival outcomes. A chest compression fraction of at least 60% is recommended, and a goal of 80% is often achievable with good teamwork. At the end of the exercise, your instructor will conduct a debriefing session to determine where improvements could be made in future attempts.
Okay, you guys, that should hopefully be a video that you can hear better. Let me know if you can't hear it better, and I'll see what else I can do. And that should re-review you guys on the first part of BLS. If you have questions, email me or message me, okay? Thanks, everybody.